So multiple myeloma is a cancer of the plasma cells of the bone marrow. So when there is a mutation in this plasma cell, there is uncontrolled proliferation of these plasma cells in the bone marrow. And this leads to the condition called multiple myeloma. Now, what are the risk factors for multiple myeloma? As we grow older, that itself is a risk factor, so age itself is a risk factor. And various studies have shown that it's more common in men than women. Certain insecticides or pesticides also increase the chance. Exposure to that also increases the chance of getting multiple myeloma. Now, family history of multiple myeloma or any other plasma cell disorder can also increase the chances of having multiple myeloma. To diagnose multiple myeloma, we do some basic investigations like complete blood count, which may show anemia, and we also have to do a renal function test, which could show elevated creatinine, which indicates renal failure, and we also do a serum calcium, which may be elevated, and it is called as hypercalcemia. And we do a whole body PET CT or MRI, which could show bony lytic lesions or fractures. And the next step would be to do a bone marrow aspiration and biopsy, which will reveal more than 10% of the plasma cells. Now, how are we going to treat this condition called multiple myeloma? So it all depends on the age of the patient and how fit the patient is. We generally classify these patients into autologous stem cell transplant eligible or not eligible, generally patients who are less than 65 years of age and who are quite fit and who do not have any other comorbidities or like heart disease or diabetes or any other issues. What we do is we go ahead with a chemotherapy plus some targeted therapy for 4 cycles or 4 months. And then we follow it up with this procedure called high-dose chemotherapy and autologous stem cell transplant. And then we follow it up with some maintenance oral medications or injectable medications. Once considered a very bad disease with very dismal prognosis in the 1990s, these days we are able to offer a median survival of around 8 to 10 years for a patient who is diagnosed with multiple myeloma.